Hello everyone, welcome back to my YouTube channel Midcode Education. In this live, I'm going to explain some important chapter nervous system 16K. Okay, 60000. Okay, so let us start. First section, skull, meninges, and brain. This category is 610002 to 62258. Okay, this is the range of skull, meninges, and brain in nervous system. And next important is spine and spinal cord. 622, 632, 63746. This is the range of spine and spinal cord. And PNS, autonomic nervous. 64400 to 64999. Okay, this is the the range between PNS and autonomic nervous. First is twist, drill, burr hole, or trephine. 611052 to 61253. You can just note it down your CPT textbook. You can just open your textbook and look at this important codes. Okay. Trephine. Trephine means cylindrical or crown soap used for removal of bone or disc. And what is burr hole? Burr hole means it is about the diameter of an index finger. Okay. Performer. What is the means performance here? Injection, drainage, insertion, and biopsy of the brain or a tumor. Clear? Okay. Injection, drainage, insertion, biopsy of the brain or a tumor. Next is craniotomy or craniectomy. Uh, the code range is 61304 to 61576. Okay. So craniotomy. Otomy means opening in the skull. Okay, it's a opening in the skull. And craniectomy. Ectomy. Okay, ectomy means removal. Clear? In medical terminology, both the craniotomy and craniectomy are repeated thing. Okay. Craniectomy means it's a removal or excision of a portion of a skull, and otomy means opening. Clear? Okay. Otomy means opening in the skull. Craniectomy means excision of a portion of the skull. And guidelines. Guidelines, if burr hole or trephine is followed by craniotomy at same operative session. Okay. Burr hole or trephine. Both are same. Okay. What is the another name of burr hole? Is a trephine. Okay. Burr hole and trephine are both are same. Followed by craniotomy at same operative session. Use 61304 to 61321. Okay, this is the range of burr hole or trephine is followed by craniotomy at the same operative session. Clear? Do not use 61250 or 61253 trephine or burr holes. Okay, don't use 61250. Okay, you can use only craniotomy case at the same operative session followed by the burr hole trephine followed by craniotomy. In the special cases, you can use 61304 to 61321. Okay. And burr hole or trephine plus craniotomy equal to craniotomy code only. Okay. Both the condition. That's why the main important thing is burr hole or trephine. Also, physician mentioned craniotomy. You can code only for craniotomy. Okay, craniotomy code only craniotomy. The range 61304 to 61321. Clear? And what are the procedures in nervous system? First of all, implantation of intracavitary chemotherapy. Okay, 61517. Okay, this is the range. And electrocorticography. Okay, the range 61536 to 61539. Okay, just open your textbook and look at these codes. Okay, craniotomy. Okay, it's a mistake. Craniotomy, hypophystectomy, 61546, 61548. Craniectomy for craniosynostosis. Okay, 615502 to 61559. Excision of amygdala of epocapectomy 61566. The it's a little bit difficulty to pronounce. No issues. And so this is the procedures done in the nervous system. And look at all these codes. Okay. Next is surgery of skull base related. The code range is 615802 61619. Okay. Approach procedure. What are the procedure approaches in this session? Anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. These are the important procedures. And definitive procedures means base of anterior cranial fossa, base of middle cranial fossa, and base of posterior cranial fossa. And also repair done or reconstruction of surgical defect skull bases are done. Main important thing in this skull base surgery procedure, M62 should not be reported with the skull base surgery procedure. Okay, M62 should not be reported. M62 is in the it's a ICD code. Not use ICD M62 code to the skull base surgery code. Okay. Report the code for the specific procedure performed by each surgeon. Okay. And more than one procedure. Okay, more than one procedure by same surgeon, then both codes are reported adding M51 to the secondary additional procedure. Got it? Here, um, M51 is a modifier 51. Clear? Modifier 51 and M62 is also modifier. Okay, not an ICD. It's a modifier. So, more than one procedure done at the same surgeon or same physician, same time, you can just report the code M51, modifier 51 to the secondary additional procedure. Okay, so first procedure, you have mentioned the first procedure, and the second procedure, add M modifier 51 to that. Okay, so this is the basic guideline in this session. Also, one question are there. Dr. X performed middle cranial fossa approach incision through infratemporal preauricular with craniotomy of neoplastic lesion from infratemporal region intradurally, and also perform dural repair with graft due to the leakage of CSF, cerebrospinal fluid. Clear? CSF means cerebrospinal fluid. A secondary repair is performed in the middle fossa by Dr. Y. Report the procedure. So try to answer this question. Next is laminectomy versus laminotomy. Okay, ectomy versus otomy. So the range between 63001 to 63051. And here a complete versus partial excision of lamina are done. Code by spinal region include decompression. Questions. Laminotomy, cervical 1 interspace unilateral. Laminectomy, cervical 1 interspace bilateral. And also laminotomy also. Okay. So try to solve these questions one by one. Okay. Next is chemo denervation 64642 to 64647 is the range. Here extremity are the trunk muscle are there. Okay, 245 is the extremity range, and 46247 is the trunk muscle range. So, if you get any documentation, you can just read carefully, and only after that you have to code. Okay. Guidelines. Report 64642, 643, 644, 645. Okay. I mean extremity. Okay, once per extremity. Okay, it's a once per extremity. And code 642, 643, 644, 645 can be reported together up to a combined total of 4 units of service per patient when all 4 extremity are injected. Okay, four extremity in your documentation, the physician or the doctor documented that a patient can get four extremities. Okay, four extremities. You have to code 642, 643, 644, 645. Clear. And another case, import report only one base code 64642 or 644 per session. Per session, you have to report one base code only and report one unit of additional extremity code 643 or 645 for each additional extremity injected. Clear? Right hand 3 muscle and left hand 5 muscle. So code it. Muscle means, trunk muscle. The range is 46 to 47. Okay, clear? Move on to another section. Uh, this is, eye and adnexa, ocular adnexa related 65091 related session. Okay. Okay, guys. Let us take eye and ocular adnexa in the next class. I think tomorrow I will provide live class for this. Okay. So let us take in our next class. Hope I hope this video is helpful for all students. Thank you, guys. See you in the next video. Bye bye.